Thank you very much for the invitation. I'm Dr. Bruno Dillemans. I'm a bariatric and metabolic surgeon here in AZ Sint-Jan in Bruges. Bruges, which is a bit the capital of a very nice province in Belgium, West Flanders. It's also called the Venice of the North. Beside that, and being a bariatric and metabolic surgeon, I'm also the chair or the chief of the Department of General Pediatric and Vascular Surgery. I'm also the president of the Belgian Society for Obesity and Metabolic Surgery. So on that part, that's me. I think stapling are becoming now so, let's say, needed and necessary tools to cut organs or to make connections, to make anastomosis. Now, two critical features or two critical issues are the safety of the operation, I think, in terms of not having a leak during your stapling or anastomosis, and bleeding. This is certainly the safety. The other part is also still a bit important, is the ergonomics of your stapling device, the easiness to handle it, etc., the dexterity. But the most critical part is indeed the safety, and then we have to look for what are your percentage of having a leak or a bleeding. And happily, the devices nowadays have become much better than they were, I think, in the 90s. So there have been a very good evolution. I think we did a nice job with Professor Jan Mulier, who is now just on pension. He was our chief of the Department of Anesthesia, and we together worked quite a lot in trying to improve our bleeding percentage, and we succeeded in that. We published that as well. And one of the most important things that helped us was that our anesthesiologist, Professor Mulier, has now systematized the fact that during the operation we keep a very low systolic blood pressure, and at the end we are increasing that. And at the end you're suddenly going to see all different bleeding spots. We can tackle that by clips of with the harmonic, etc. So that was a very, let's say, easy on the surgery part, not so much for the anesthesia part, a method to try to see where are the bleedings at the end of your operation. You're going to tackle that individually. The second most important evolution is the upgrading of the stapling devices. And one of those things that initially there were 2 rows of staples, they all evolved to 3 rows of staples. Nowadays we have all circular stapling devices, not with 2 rows but 3 rows of stapling devices, just one clinic can provide us. But also I think that nowadays you have the resurfacing of, you have the staple reinforcing of some devices. We had that from Gore, the SimGuard, etc. But nowadays we have also cartridges with some reinforcement on the cartridge itself. So that is certainly also an added advantage. And we have seen that our risk to have a extraluminal or intraluminal bleeding has dramatically decreased. I don't have a vast experience yet in using the Lunar. We have to say the things as they are, but it seems to me that the compression of the device is fairly well, let's say. There's a good compression. There's still not a reinforcement on that, okay, but I think the way, back again, I don't have that vast experience. I can see that when we elevate the systolic blood pressure at the end of the operation, that we don't have that vast amount of distinct bleeding. So I think it's fairly well. So I really think that it looks to be a very also easy to handle a device, also for female surgeons. You nicely can turn also the cartridges in the angulation that you're willing to have, not unimportant. You also to make what we call GG anastomosis, the connection between 2 parts of the jejunum when we do a wide gastric bypass, goes very fluidly. Also the removal of that. So on that part, I'm really pleased at the stage that I really can say, because back again I don't have that huge experience, but it looks to be a good device. And also the electronically way, systemized also to wait 15 seconds before you fire. It's something that we don't have to care or to count ourselves. There are some good features on that device, I have to say, the things as they are. Yeah. So that still has to be sorted out by having more experience. I think that dexterity of the easiness to handle the instruments is certainly, I think, a beneficial thing. And back again, also the cartridges are quite well fitted, and the compression of the device looks to me, you can grab it nicely. and you also can tailor a bit the way you grab it. So you still can remove some stomach or tissue away of that when you are gradually closing your instrument. Those are small features that could add some benefit towards the competition, I think so. Yeah. But back again, I know really that has to be further defined by having more experience in that. Yeah, thank you very much. Everybody is certainly welcome also here in the future to join us on one of the bariatric courses. In my experience, you know, in many years, we may say that we have evolved a bit, and that was one of my presentations to a bariatric surgery reference center. So a lot of revision surgeries have been done here in our institution. I think that for those surgeons that are willing to, you know, go to the next level, whatever means next level, but anyway, to try to advance their skills, I think they're going to be more than welcome to join us at the course. I think it's going to be interesting, and always pleased to welcome everybody.